Good afternoon, and welcome to our webinar, Psychosocial Deprivation and Neurocognitive Functioning, Long-Term Effects on Cognition, the Brain, and Mental Health. My name is Dana Asby, and I will be your webinar manager and host. Today's meeting will last approximately 1 hour with a brief 15-minute meeting of the Childhood Trauma Learning Collaborative Fellows afterwards. Microphones will be muted during the presentation. At designated times, for example, during our question and answer session, you can use the raise your hand feature to request an open mic. Thanks to participation with C4 Innovations, we are offering 1.25 hours of continuing education credit for each webinar in this series. We can also offer you a certificate of participation. Registration affirms your consent to receive an evaluation follow-up link via email and your consent to recording. If you experience any technical issues, please send a private chat to Ingrid Paget, our technical support manager for today's webinar. We're pleased you joined this webinar, and I'd like to now introduce Dr. Christine Mason, founder and executive director of the Center for Educational Improvement and project director of the Childhood Trauma Learning Collaborative.
Thank you, Dana, and welcome. We are so excited to have our speaker with us today. And as we reflect on this topic and we think about everything we've been covering over the last year, we've covered a lot related to mental health concerns and thinking about the implications for schools. In the session today, we're going to go a little deeper into some of the psychology and some of the research that is tangential, but nonetheless very important to what we need to think about as we work with children and think about their backgrounds, their stress, their trauma, everything they bring to school. So we welcome you and want to just let you know that there's more in this series, more to come, and we're glad you're with us.
Thanks, Dr. Mason. And now I'd like to introduce today's presenter, Dr. Sonia Troller-RENFREE, postdoctoral research associate at Teachers College, Columbia University. You may remember our last speaker, Dr. Noble. Dr. Renfree works in her neurocognitive an early experience developmental lab, and she is going to be presenting on psychosocial deprivation today. And we just wanted to point out the relevance for all of us as educators, as a lot of the things she'll be talking about with neglect apply to American children's experience in neglectful homes and foster care. Dr. Troller-RENFREE, I turn the webinar over to you.
Thank you so much. Thank you to all of you for the invitation, and I'm really thrilled to be here today. I really love, as a sort of traditionally trained scientist, it's easy to sort of zoom in on very small questions and forget to zoom out sometimes. So this is one of my favorite things to do, is to really take a moment and think about the sort of translational aspects of the work that I do on a normal day. And so I'm really happy to be here. So I want to start out just really sort of setting the stage for what I'm going to be talking about today. And in particular, I'm going to be talking about neglect and foster care. And neglect, when you think about, I'm going to be talking about it in a really sort of extreme sense in some ways, but neglect is really actually one of the most common and prevalent forms of child maltreatment here in the United States. In fact, it is actually more prevalent than every other type of maltreatment combined. And so when you think about the likelihood that a child that you've worked with in a school or in your practice, the likelihood that a large percentage of those students or patients that they've impacted or have been impacted by neglect is very high. And so one of the things when we think about children who experience neglect, one of the most common sort of interventions, if you will, is foster care. And so foster care in the United States, and if you want to flip the slide, is not a really uncommon experience. So right at this moment, it's estimated that over 400,000 children in the United States are experiencing a foster care type environment. So whether that be a group home, whether that be in a one-on-one foster care environment. And so foster care really isn't an uncommon experience for children in our school systems, as well as children who are accessing professional services. And so at this moment, I think we have a little poll, just to give me an idea of how you've interacted with foster care and neglect in your own practices in school. So hopefully we can do that. Perfect. So I'd be really interested. The question is about how many students at your school are in foster care, group homes, and or other neglectful home environments. All right, so it's really interesting. I mean, we really have quite an array here. One of the things that's most interesting to me about these results is nobody said none. So it's not like, any sort of uh, educational space is not devoid uh, of the experience of neglect or foster care. And what's really also that really sort of sticks out to me is a lot of you aren't sure, which is also a really interesting thought to me, particularly because when you think about a classroom or addressing your students, little behavioral problems, little changes in how children may think may be stemming from an environment of neglect or the home environment. We're going to talk about some of those aberrations we see that are related to foster care and neglect today. And you may not even know that that's sort of the genesis of these behaviors. And so I'm really sort of excited to think about maybe giving you some information on how to sort of identify some of those behaviors as well. So moving forward to sort of a even more uh, profound level of neglect is institutional care. Now, this probably isn't so relevant to all of you, considering that institutional care, at least in its very technical definition, isn't that prevalent here in the United States, although some group homes and children's hospitals sometimes can be argued to reach the technical definition of institutional rearing. Large institutions, or what sometimes are known more colloquially as orphanages, are not common here in the United States and mostly have been outlawed. And why I'm highlighting institutional care, though, is it's a really good way, there's sort of a really good model for looking at neglect and how it impacts the developing child. And particularly, it's really good because it sort of narrows down the kind of deprivation a child is experiencing. So particularly children in institutional care commonly have enough material resources, so they have enough food, they have a roof over their head, but that they're really missing is that sort of serve and return with a parent who's really giving them contingent caregiving. Doesn't always have to be a parent, it even could be a parent surrogate, but most of these children really don't receive that sort of care. And because institutionalization is so sort of clearly defined, it's very easy to see when in the lifespan a child experiences institutionalization. Whereas when you think about neglect more broadly, it's very hard sometimes a child going from a neglectful home to a more neglectful foster home. It may have sort of the same environments, but very different sort of visions of what their caregiving looks like on the outside. So one of the reasons I'm talking about sort of institutional rearing and neglect and foster care is that I think that these sorts of environments really sort of make us look at child development differently. And as a developmentalist, I always think when I think about child development, there's two central tenets that I think are really important that we examine when we think about the developing child. And these tenets are sort of violated by early neglect. So the first tenet that I want to talk about is that early experience matters more. So early experience, the experience in the first few months or years of life, are likely to have a really profound impact on later psychological, but also cognitive functioning above and beyond years that sort of come later, so later childhood and early adolescence. The second tenet is the idea of critical or sensitive periods that exist in development. So critical or sensitive periods, we're going to go over them in a little bit more deeply. But what a critical or sensitive period, sort of why it's important for development, is that your biological systems, your cognitive systems are really ready for a certain kind of input. And your body and your child, the body of a child, are really expecting things like caregiving. And so what happens when that doesn't sort of occur at the time that we expect is one of the questions that we're going to delve into today. So really quickly, I'd like to go over why does early experience matter so much. So one of the first reasons is a concept called neuroplasticity. And I think when I was clicking through a few of the past webinars, I think this has been covered before, but just in case you weren't at those webinars, I want to just give a little primer. So the idea of neuroplasticity is that your brain, when you are born, is called plastic. Now, the idea of plastic really means malleable. So your brain is open to change. And how your brain changes is really due to the experiences that you encounter as a child. So the idea that experience is driving most of your postnatal brain development is where neuroplasticity comes in. So if you look at, there's a graph at the top left, there's this really nice sort of X-shaped function that I think is really important, which shows that your brain's ability to change is really, really high when you're a young child. But as you develop, the ability to change your brain goes down, and particularly it goes down most rapidly between the ages of sort of 0 and 20. Sort of equally interesting, the amount of effort that you need to sort of change your brain or change sort of how your brain has been wired, or how experiences have impacted your brain, you need a lot more effort, a lot more input, a lot more experiences to reshape the brain later in life than compared to earlier in life. And there's lots of evidence for this, both in the animal world as well as in the human world. So that I have a little image right here of an early experiment done by Harry Harlow. It's a little tiny infant monkey sitting on a cloth mother monkey. And what you can't see is off to the side, the baby monkey also had the ability to choose a wire mother with a little bit of food on it. And what we see in here is that this infant monkey is choosing this cloth soft mother over a mother that provides sustenance. And so this is some of the early emerging evidence that early caregiving is one of those really early experiences that monkeys at least expect. But also there's really good evidence that humans expect this early experience as well. So for example, up here in the picture with a little girl, and there's a scientist over here, he's cut off a little bit. This is John Bowlby, who did some of the earliest work on attachment. And he has a really nice quote that I really like when we think about early experience in parenting, which I always use to sort of contextualize everything we're about to talk about. So Bowlby, and this is, back in the early 1900s, said, prolonged separation of a child from his mother or a mother substitute during the first 5 years of life stands foremost among the causes of delinquent character development and persistent misbehavior. And so that's one of the things that I want to talk about today, how early experiences may shape how the adult acts later on, and how it may be really hard to sort of erase or ameliorate those early experiences if they're negative. All right, so moving on. There are two types of experiences that we can sort of encounter in our lives, and we all encounter both. The first one is what I'd like to call experience expectant experiences, which I know is 3 E's in a row. But experience expected experiences are experiences that are given to all members of a species. It's something that every member of a species is supposed to intersect with. So for example, for an adult or a human, it may be a maternal figure and maternal caregiving, but it also could be something as easy as needing to experience light and contrast in order for your eyesight to develop, or the need to encounter language in order to learn language. And there's a lot of evidence to support that humans are sort of all humans are wired to get this input and are expecting this input. So it's a universal sort of experience for all. So let me see. We're going to skip. I think we've covered that sort of. And sort of particularly brain development takes advantage of expected experiences to shape developing systems. So what we see in the brain is that small parts of the brain will develop, and then they'll expect an experience, like, for example, light for vision, but also other systems. So we think that there are systems for attachment that really expect a caregiver in contingent caregiving. And so these are, and when those experiences are encountered, the brain wires itself in a certain way. However, if those experiences are never encountered, the brain's not able to wire itself in an adaptive way, and you may actually then lose your ability to do things like, for example, see. All right, so the other type of experience is experience dependent. So this is sort of the accumulation of information that's unique to the individual. So for example, things like how warm was your mother would be an example, right? There's a variation in how warm to how cool your mother acts towards you may change how you develop and how your early systems develop. Or for those of you who are educators, you may think of school quality or teacher quality, right? You may have a system that's malleable, say math learning, and if you have a really supportive teacher who's really giving you high quality input, you may deviate from a peer that's exactly the same but doesn't have the same input. And so this is sort of experience dependent. Your system may be expecting it, but you can hone the system based on the quality and the quantity of the input that you receive. And so these experiences differ both in kind and timing. So across development, there are different types of these experiences. And the brain incorporates this information as it becomes available, but it doesn't necessarily need it in order to develop in a expected way. All right. So moving on to the second tenet, if you remember those two developmental tenets I talked about, the second tenet is the idea of a sensitive period. So what is a sensitive period? A sensitive period is a limited time during which experiences impact a brain more strongly in a certain domain. So the idea of sensitive periods is that you're allowing experiences to instruct neural circuits to process information in an adaptive way. Sensitive information, during a sensitive period, really important information is sort of given to the developing infant or child or animal that is essential for normal development, and if you don't get that information during that period, it may alter your development in a more permanent style. And early experiences in the first years or months have been shown to have sort of the highest density of sensitive periods, but also if you miss a sensitive period early in life, it can become more difficult to sort of take in what comes down the road. So for example, I really like this, there's a little graph here with sensitive periods in language. So first, the idea is that you have to learn phonetic categories, and then you have phonological categories, and it's very difficult if you don't get good input in phonetic categories to then learn phonological categories. They build on one another. And so the idea of if you don't get the input you expect during a sensitive period, it can be very difficult for later development. So now that we think about sensitive periods, why do sensitive periods matter? So like I said, during a sensitive period, there's expected experiences that may be essential for normal development and may alter performance permanently. And we see examples of this sort of throughout the animal world as well as the human world. So for example, this little picture of a guy walking in a field up here, this is an ethologist named Konrad Lorenz, and what you can't see, because I think the picture got cut off, but following him across this field is a whole group of little gray lag goslings. And the idea of these gray lag goslings is that when a gosling hatches, the first biological movement that gosling sees, they think of it as their mother, and they start following around whatever it is and sort of learning how to become a gosling. However, if a gosling doesn't see sort of biological movement during the first few days of life, they actually will never form an attachment, a maternal-like attachment later in life. And so what that will sort of end up down the road is those goslings don't know how to act as typical goslings. And so they become a little bit more awkward. And that's a great example of sort of how the lack of, in the gosling's world, maternal caregiving was an expected experience. And if it doesn't happen on a certain time scale, it actually fails to develop in general. There's also examples of changes in the brain from doing things like putting an eye patch on cats or suturing cats' eyes shut, showing how the brain changes in ways that actually make that eye functionally blind. So we see many examples of this throughout the animal world, but also in the human world, where there's expected input, and if it doesn't happen during that sensitive period, the performance or the sort of skill that's supposed to be learned is either altered or permanently lost. All right. So for today's talk, I'm going to be talking particularly about or using a model of institutional rearing to talk about neglect and foster care more broadly. So I'm hoping to use what's a really nice study because it's purely experimental in nature to draw some really interesting conclusions about what we might learn about how institutional rearing, but also neglect and foster care may impact child development more long term. And so in particular, I'm interested in trying to address two questions. One question is what happens to brain development when there's a violation of an expectable environment? And one of that expectable environment that I'm going to talk about today is the idea of a contingent caregiver. As humans, I think we're put together to expect an attachment figure early in life. We're born in a sort of state where we can't feed ourselves, we can't take care of ourselves without a caregiver. And so what happens when that caregiver is absent? The second question I want to talk about is whether or not if you have early experiences of neglect stemming from the absence of a caregiver, can we ameliorate some of those deficits through intervention? And I'm going to show some intervention effects through foster care, but we can also talk about other types of interventions that may be able to ameliorate the effects of early deprivation or neglect. All right, so to answer these questions, I think it's important to think about the kind of neglect that's faced by children growing up in institutions, particularly because that's the experimental sort of framework I'm going to use to introduce some of these deviations in development. So what are the kinds of deficits or neglect that are faced by children growing up in institutions? One of the major things that's experienced by children growing up in institutions is insensitive care. So these children tend to have regimented daily schedules. Everything happens at the same time every day, regardless of whether or not a child needs that thing at that time. So the example of having a potty break at a specific time, whether or not a young child needs to go, is not particularly advantageous if a child isn't really aware of their body and when they might need to use the restroom and can become a mess later on. And so this is true across a number of domains: feeding, playtime, napping. If you're put onto a non-individualized care schedule, that's very species in some ways atypical. When we think about a one-to-one caregiving relationship, of course, we sometimes put those sorts of things into action, but not always. Another thing that these children sort of come into contact with is a lot of isolation. So the idea of not a lot of response to distress. So, an infant may be upset, laying in a crib, crying. And if you have a caregiver who's not able to respond to that distress, these infants may really have sort of learned this idea that there isn't sort of this contingent caregiving when they are feeling upset or neglected. Another thing is that there's a lot of unchecked aggression among older kids, both between the individuals in the institution themselves, but also between institutional workers and children themselves. And then finally, there's a pretty strong lack of psychological investment by caregivers. So there's high rotating shifts. There's sometimes caregivers go from one group of children to another, so they're not able to sort of learn the children's wants and needs. But also even caregivers who are trying incredibly hard can't really succeed because there's a really high child to caregiver ratio. So sometimes up to 30 children to one caregiver, which makes it very difficult to not only provide individualized care as expected by the child, but really also to just invest in those children in a way that's going to make them feel loved and cared for. And what I want to sort of highlight is, again, while we don't have institutions in the United States by the definitions that we do in Romania, we really do have sort of environments in the United States where there are very similar experiences. So neglectful homes maybe don't have child caregiver ratios, but the likelihood that children in such environments run into things like isolation or insensitive caregiving is not that far of a stretch of the imagination. And so I'm hoping that as we sort of go through some of the data from this institutional rearing study, we can use that to inform what we might be seeing in our own classrooms and practices. All right, so with that, I'd like to introduce the Bucharest Early Intervention Project. It's a study that started in the fall of 2000 and it's still going today. So it's been a long-running longitudinal study looking at early neglect and deprivation on child development. And particularly, it's a randomized controlled trial of a foster care intervention. And so I would be remiss to not introduce the research team, because this hasn't all been done by myself. So right here, I would like to highlight these three gentlemen who are the principal investigators. Dr. Charlie Zena, who's on the far right, is a child psychiatrist at Tulane. Dr. Nathan Fox is in the middle, and he's a professor of developmental neuroscience at the University of Maryland. And then Dr. Charles Nelson, who's also an expert in child neural development, who's at Harvard Medical School. And these three gentlemen also recently published an entire book on this study. So if you're really interested in really diving into Romania and all the findings and sort of the deep sort of context that got Romania into the place where it has a lot of institutionalized children, or did have a lot of institutionalized children in the 90s, I'd highly recommend checking out that book, because it can cover a lot more than I can cover in an hour. All right, and this also just highlights our funders, which were the National Institute of Health and the John D. and Catherine T. MacArthur Foundation. All right, so what were the goals of the Bucharest Early Intervention Project? Well, I think there are three that are important to highlight for today's talk. One of the goals of the Bucharest Early Intervention Project was to examine the effects of institutionalization, which is really severe psychosocial neglect, on brain and behavioral development of young children. The second goal was to determine if the effects of early psychosocial deprivation or institutional care could be remediated through an intervention. And in this case, it's going to be a high-quality foster care. And when I say a high-quality foster care, I mean a very high-quality foster care, sort of the Cadillac of foster care systems. So we're going to delve into a little bit into that a little bit deeper in a few slides, but really highlighting some of the things that we think are essential for a high-quality foster care system to sort of ameliorate the deficits we see associated with early deprivation. And finally, we would, of course, wanted to improve the welfare of children in Romania by establishing foster care as an alternative to institutional care, which has actually been very successful. And I'd be happy to sort of talk about how we've changed the rearing environment and policy for children in Romania as well. All right, so at this point, I think we're going to stop and chat a little bit.
Okay, so Dr. TROLLER-RENFREE, thank you so much. I mean, it's fascinating. It's been a while since I've thought about Romania and the orphanages. I can remember back in the 90s when information came out, right, about the sad, sad state of affairs there. And so many of us were really just appalled and really wondering, like, what on earth can be done? Mm-hmm. So it sounds to me like something's happened. And if you think back over the work you've done and others have done, does Romania still have a problem in terms of the number of orphanages? And how is your work really impacting the larger society there in Romania?
Yeah, that's a great question. So, you know, you're right that when Nicolae Ceausescu, which we'll go into in just a second, was the communist dictator of Romania, when he was deposed in 1989, excuse me, there were over 100,000 children in Romania, which is a relatively small country in institutional care. And the difficulty when you think about institutional rearing in a country is it's very hard to sort of, institutional qualities vary from institution to institution. It's very hard to necessarily say that these children are going to fare worse down the line. Indeed, even Ceausescu and the government surrounding him in some ways advertised institutions as actually a very adaptive place to put children, because it would sort of get them used to routines and schedules which are essential for the workforce. That being said, you know, time has passed, and our research, which we're going to go into, has really showed that institutional rearing isn't that adaptive for a child and really is a pretty severe form of neglect. And so one of the things that we did with this study that we'll talk about is we set up the first foster care system in Romania. So we really recruited foster care parents, we interviewed them, we supported them in hopes of showing that foster care would indeed be better for children than institutional rearing. And the data did sort of bear that out, although differently across domains. And so since then, Romania has actually put into place their own foster care system, which has removed thousands of children from institutional rearing there and put them into sort of either typical foster homes or smaller group homes instead of these larger institutions where the caregiver to child ratio is much more advantageous. And also we're trying to continue this work because one of the questions that sort of still remains is what happens when these children leave their foster care home or the institution, where do they go? And we were actually just recently funded to keep following these individuals in hopes to see sort of how they fare in the workforce and economically, and also in sort of the mental health and educational domains.
So I'm thinking about foster care in the United States, and we hear frequently of instances where children move from one place to another, right? And how as the children and youth are placed one place, it doesn't work out, they go to another, they just kind of fall apart, right? Life gets worse, their stresses increase, and their likelihood of turning to drugs, delinquency, depression really increase.
That's right.
So did you learn some things in Romania that might help us improve what we do with foster care here in the United States?
Yeah, so I think there's really a number of insights that can be pulled from the Romania foster care system that we set up that really could inform some of the practice here in the United States. So for example, one of the things that we're going to talk about coming up here is that we recruited incredibly skilled social workers, and we gave them really manageable caseloads so that they were able to really follow up with and support families in times of crisis. These social workers were available 24 hours a day to these families. They were hands-on during the initial transition phase, which can be one of the hardest for families, because when you get a child who comes into your home and you're not aware of their behavioral problems or the need that they may have, it's really hard to sort of accommodate for something that you don't even know what to expect in the first place. And so having sort of those sorts of resources, I think we can show is incredibly important. We also had a number of focus groups and a whole team of experts helping these foster care parents. And so I think a lot of the sort of boon of our foster care program comes from those sorts of support systems being in place. But just like a foster care system here in the United States, we also had children who went through multiple caregiving transitions or multiple foster care homes. And we actually have really strong data suggesting that that is not very good for child development. So we really tried very hard to help foster care parents, plan for permanency and work through issues. And when that was the case, it seems like those children on average fared better both in mental health and in other domains.
Thank you.
Yeah, of course. All right, so moving forward, I think we covered this very slightly, but just to set the stage for some of the data I'm going to show you from Romania. In Romania, there was a communist leader, Nicolae Ceausescu. He had this goal of sort of, improving Romania's stature in the world, and one of the ways that he thought he could do that was by increasing the size of Romania's workforce. And so one of the first things Ceausescu did was he had this decree where he really outlawed abortion, contraception. He levied a tax against women of childbearing age who weren't actually currently pregnant. He had enforced mandatory gynecological examinations of women who weren't having children. And this worked incredibly well. There was a huge increase in number of births in Romania. And like I said before, when Ceausescu fell from power in 1989, there were over 100,000 children who had been abandoned into institutional care, which was the only option for parents at the time. There wasn't a foster care system to put children into. And so the number one reason that parents actually abandoned or left their children into institutional care was poverty. And what's really interesting is I'm saying this word abandoned, but one of the interesting parts of the Romanian institutional care system is that when parents actually placed their child in institutional care, they didn't terminate parental rights. So some of these children were really had many caregiving transitions because they'd be placed in institutional rearing and then their biological family may take them out, but also that gave families sort of this idea that they could take their children in and out as needed. So a lot of families may even have had the idea that this would be a temporary placement into into institutional care until they sort of got their feet under them. But on average, that really wasn't the case. All right. So moving forward, I have a few images from institutions that were taken mostly by my colleagues when they first went to begin the study in 2000, although I have also encountered some of the institutional settings, and actually very interestingly, our research lab that we have there in Romania is a full-fledged research lab and is actually built in one of the old institutions that has subsequently closed. So if we start with the first picture, ooh, can we go back? Thank you. The picture on the top there, this is a picture from the infant ward, and you may be able to see that this room has 4 cribs lined up on one wall, and I believe 4 cribs lined up on the reverse wall. And this is not, it would not be uncommon for a room like this to only have one caregiver or so taking care of all those infants. And so you can imagine how difficult it would be to comfort these infants and take care of them. And as one of the one of the principal investigators tells the story that I think is really remarkable, that a lot of these rooms, when you enter them, even though they're full of babies, they're completely silent. And that's because these babies have forgotten or have learned that crying doesn't actually get you sort of the contingent care that you need. So crying in distress doesn't mean that somebody will necessarily come and attend to you. And so these babies learn not to cry. And so it's a very interesting and really profound story that I think highlights the neglect that you see in these sorts of situations and institutions. Up on the top right, you can see a line of, those are like standers or bouncers, as I think they're called sometimes as well. And you can see that this is standing time or play time for a bunch of toddlers, and they're in a hallway just all lined up one by one and in their standards. And you can imagine that this is not a very complex way to interact with the world for a young toddler, but it does, of course, provide the caregiver with a second to sort of have their hands free. You can't keep track of tons of toddlers at the same time in a very beneficial and easy way. And so you can imagine that these sorts of early experiences with the world probably shapes how a child learns to play and interact with others. And then in the bottom left corner, I'll just highlight one more of these pictures. All of these children are sitting up in a row, and you may see that they're sitting on a trough. This is potty time. So all of these kids, you know, one at a time sat down having their bathroom break, and it's on schedule, on cue, right? So they aren't just being able to sort of come and go as they please, but rather they're all on the same schedule, which is another example of that routinized care that we discussed. So next I want to go over the design of the Bucharest Early Intervention Project, and sort of highlight why we're talking about it in general, because you may say, sorry, I'm sometimes not great at computers. Okay, so why we might be talking about the Bucharest Project and the power of the Bucharest Project. So moving sort of forward, we can go forward. The Bucharest Project, why don't we just go ahead and skip this too? All right, so the Bucharest Project, go back one though. Thank you. So the goal of the Bucharest Early Intervention Project was really to do a scientific experiment to examine whether or not children who get a foster care intervention fare better than children who are experiencing extreme neglect, and in this case, it's institutional care. So what we did is we went into Romania, we went to 6 institutions, so that's those numbers 1 through 6 across the top, and we assessed 187 infants who were in institutional care, and we looked for things. We had them have a pediatric exam, we took growth measurements, we tried to look for any sort of physical abnormalities in order to recruit a big sample, or as big as we could, of children who were typically developing, at least for an institutionalized child. And so once we had that group of children, we put their names or numbers in a hat and we drew them out, and they had an equal chance of being in the care as usual group, which was going to be continued institutional care or care that the Romanian government gives these kids. So later on, they'll be transitioned into sometimes foster care homes. And then the foster care group, which is going to be our Cadillac foster care program. We also recruited a group of kids that are all the way off there to the left in the never institutionalized group, or the NIG. Those kids are who have never experienced institutional care, but of course they're not randomly assigned there. So this is, those children are children who are being raised with their biological family in a typical way. So the strength of this design is that the idea of a randomized controlled trial for our two randomized groups, which are our foster care group and our care as usual group, those children should be, when we randomize them, exactly the same. They have the equal probability of being in one group or another. And so our goal by having this sort of intervention is we can really, in a causal manner, say whether or not a foster care group or a foster care intervention improves the outcome of children. And we're going to go over in just a second sort of the benefits of a foster care home and the Cadillac foster care homes that we put together in order to bolster child development. So moving forward, so the foster care team in Bucharest was comprised of 3 social workers, and we had about 60 kids in foster care, so that meant there was about 20 kids per social worker, which in comparison to the United States and some of the social workers that I'm sure you all may interact with in an educational setting, that's a really nice and light load. So we really were able to have these social workers concentrate on these children in a really granular sense. We also took great care to match families and children. So for example, if a foster care family said, I really want a girl, or something like that, we did our best to try to match families and children together in hopes that we would have higher levels of permanency and less issues just related to like the identity of the child themselves before they've even entered the home. The next thing is these foster cares also helped prepare, the social workers helped prepare the applications for foster care. We also had to go through a number of government entities, of course, to sort of figure out where these children would go and get consent to do an intervention like this. And so they helped a lot with that process. And that's sort of the same, but they would make appearances before the commission to get consent to do this. They would also supervise visits with the biological family. So as I talked to you about before, the biological families didn't necessarily terminate their parental rights when they abandoned their child into foster care. And so they were able, if the biological family wanted to see their child, they would supervise those visits and facilitate those visits. But also if a biological family wanted to remove their child from the foster care system that we set up, they could. And then finally, they would also help manage challenging child behavior. So like I said, they were on call about 24 hours a day. They could, foster care parent could pick up a phone and get a hold of their social worker. And so the goal was to sort of, if they were in crisis, if there was a particular issue, if it was overnight and there were behavioral problems, they would have sort of a person there to support them. And then finally, they helped with permanency planning, which I think I mentioned earlier, but trying to make sure that these children went through as few transitions as possible. All right. So what did they do to support the foster care parents? Well, they visited the foster care parents every 10 days for the first few months when the child was placed in the home to make sure that the child was settling in, that any sort of conflicts between the child and parent were addressed, to help parents really make sure that they were supported and had the supplies that they needed. They also, even after these 10-day visits, still visited the houses of the foster care families about twice a month for the entire duration of our foster care program. They also had, that's fine. They had intensive phone contact. They took measurements of the child to make sure the child was thriving in these homes. And they would ask really specific questions to sort of help the foster care families talk about the issues that they may be encountering, so it wasn't sort of internalized and relying on their own ability to sort of identify behaviors. They could sort of help them think about it all the way through. And then they had education and support groups for these foster care families as well. So when we think about the Bucharest Early Intervention Project, there were really 3 hypotheses that we had. We really thought that, number one, institutional rearing would have a profound effect on children's social and emotional development, and by profound effect, a really profound negative effect on child development. 2, we thought removing children from institutions and placing them into family-based environments would remediate some of these deficits. And then finally, we thought the age or the timing of the placement into foster care might be a significant factor explaining how and much we can sort of intervene on certain domains. So some domains may be malleable earlier than later. And so this gets back to that idea of sensitive periods that we discussed earlier. So in the Bucharest project, we assess all sorts of domains across many sort of different aspects of child development. Today, I'm just going to talk about 3, but I know we'll have a question and answer section later. And if you wanted to ask me about one of these other domains, I'd be happy to talk about how children fared in both institutional care in general, but also in the foster care intervention. So first, I'm going to talk about how institutional care and the neglect that children in institutional care encounter changes cognition. So to do this, I'm going to talk about IQ. Particularly, IQ is one of the measures that I have a hint of suspicion that you may interact with in educational settings, particularly in IEPs and things like that. IQ, just as a quick reminder, a normal or an average IQ is 100, and then the standard deviation of IQ is 15. So particularly 100 is sort of the mean of a population, and then 70 and below is thought to be impaired. So we looked at children who had experienced institutional care. So to orient you to the graph, this graph on the y-axis, so the axis that's going up, we have the mental development index, which is really just an infant form of IQ. Same idea that the mean is 100. And then we have 2 bars, a red bar and a green bar. And so the red bar is children who had experienced any kind of institutional care. And we did this assessment prior to the foster care intervention. So this is before children were randomized to either get the intervention or not. And what you can see in comparison to the green bar, which are kids who had never experienced institutional care, children who had experienced institutional rearing had incredibly reduced IQs, or in this case, MBIs. And what was really interesting to us was to look to see whether or not children who then were subsequently randomized into foster care, whether or not their IQ increased. And the answer was yes. So across at already by 30 months, but 42 months and 54 months, we found that the children who had gotten a foster care or a family-based intervention had higher IQs and better cognitive skills than children who were getting care as usual, which for most of those kids meant continued institutional care. But also really interestingly, and if you can flip to the next slide, how much a child's IQ increased was a function of how early that child was placed into foster care. So children who had been placed into foster care before 24 months had significantly higher IQs than children who were placed into foster care after 24 months. So this pattern is really interesting because it hints at a sensitive period, or the idea that children who are placed earlier are more likely to have the cognitive benefits of being in a family-based care, and in our case that's foster care, but that in different cases that you may interact with, you may just think of a higher quality caregiving environment, was particularly impactful when children were younger, before 2 years of age. After 2 years of age, those effects were much smaller. All right, so altogether, we found that children who were living in institutions showed significant delays in IQ, and that removal from institutions, particularly before 24 months of age, remediated some of those IQ deficits. And it's really remarkable, and I didn't show a slide of this, but even 10 years later, and 10 years after the intervention began, there are still positive effects on IQ. All right. So you may be saying, okay, well, that's in Romania. What about in other places? What about here in the United States? And although, most of the evidence here in the United States, we can't randomize children to be in foster care or in their own homes, so it's not experimental, but there is a really large body of evidence suggesting that children who experience abuse or neglect in the United States also have lower IQs and lower economic well-beings. And particularly, I really like this study by Curry and Wyndham, who followed a really large set of children who were had experienced physical, sexual, or neglect, or physical or sexual abuse and neglect early in life, and followed them all the way out to adulthood. And we found that children who had experienced neglect and abuse in childhood were 14% less likely to be employed in middle age, even after controlling for background characteristics. They were also less likely to have, they were also more likely to have lower levels of education, lower earnings, and fewer assets in general. So we see very similar patterns, both in our experimental group in Romania, but also in groups of children who've experienced neglect and abuse here in the United States. All right, so what about for the brain? So I'm gonna show you a little bit of brain data, but I wanna, can you actually go back a slide just a second? Great. I just want to give you a quick note that I'm not going to inundate you with brain images of the brain and things like that. So when we looked at brain activity in these kids, we used something called EEG, which is just sort of a stretchy cap that we put on children's heads. And we really wanted to look for a specific pattern. And that pattern, which we can go forward one slide now, is something that we call a maturational lag. And what a maturational lag is that children have not enough high frequency power and too much low frequency power. Now that doesn't really matter for what I'm about to show you, but what does matter is that pattern of brain activity has been shown to be related to things like attention disorders, learning disorders, and also poorer mental health. So there's an idea that even in little babies and young children, we can look for patterns in the brain that we know are related to later behavior that is not as adaptive in educational settings as well as in adulthood. And so to show you this data, I want to sort of orient you. Right now what we're doing is we're looking at the top of 4 heads. So the circles are the heads, and then the little triangles are the noses. So you can think about like sort of looking down on a head. And what I'm going to show you is how much brain activity there is in this sort of really adaptive band. So we want to look to see how much brain activity is there. And in our case, more is going to be better. And what more will look like is warmer colors, so like reds, and less will look like cooler colors. So when we look at the first head, this is our care as usual group. So the kids who experience continued institutional rearing. And this head, you can probably see, doesn't have very much of that warm color. But then as we go forward, our foster care kids who were placed after 2 years of age have very similar looking brains. So they don't have much of that warm color either. However, kids who were placed before 24 months of age have much more of that warm activity. And then finally, the kids who have never experienced institutional care also have quite a bit of that warm activity. And so again, this sort of brain activity we know is predictive of later attention and learning issues. And we can see that children who experienced institutional rearing or were placed into foster care, but placed into foster care when they were older, are showing less of sort of this, what we think to be an adaptive brain signal, whereas children who were placed much younger or children who had never experienced institutional care, they show much more of this warm and adaptive brain pattern. Now you may say, okay, again, this is just kids in Romania. What about here in the United States? And one thing that I want to sort of highlight is that in my own work here in New York City, I've been following infants of moms who have various levels of stress. And moms who have more stress, their babies show less of this adaptive brain functioning as well. And we also see that children from impoverished backgrounds show a very similar pattern. So while we're seeing this here in an experimental form in Romania, this pattern persists here in the United States as well in children who are experiencing really severe material deprivation through poverty, through also stress in the home. So it sort of hazards to say that maybe early deprivation or early neglect or early stress in general may produce this similar pattern, and we can pick up on it at a really early age, which is very promising for thinking about future interventions. All right. So how does all of this translate to the classroom? Well, in particular, inhibitory control, which we've seen that there is also, and I'm just sort of jumping a little bit here, but we also see deficits in cognitive functioning in children who have experienced institutional care, but also kids who experience neglect in the United States. And children who have deficits in executive function and inhibitory control, our students are your students that are are going to be more unable to control impulses, leading to classroom disruption. So that might be a behavior pattern that you see more commonly in children who have experienced neglect or early abuse. Also, these students might have difficulty in concentrating on more relevant information. Again, sort of going back to this attentional component, and we may be even able to find that in the brain, as we sort of just discussed. These students also might have poor conflict resolution and less self-directed behavior, a lack of independence, and things like that. And I'm just going to go a little bit quicker. Okay, perfect. And also they're probably more likely to see deficits in early memory. So having difficulties maintaining really important information when trying to solve a problem, as well as deficits in response monitoring and the ability to perform secure attachments. And I can tell you that we see these patterns not only in institutional rearing, we see them in neglect in the United States, and that these sorts of deficits probably can trickle down into your classrooms and into your schools in sort of these behaviors. But what I really think is interesting is these behaviors are sort of stemming back to differences in neurocognitive functioning that we may be able to detect even earlier in life. And also, hopefully, I'm showing you evidence that if we intervene early, we may be able to avoid downstream effects like these.
And I think we have a poll, Sonia.
Yes, and we do have a poll, so let's throw that up. So what I would really like to hear from you is whether or not you encounter these behaviors in your classroom or school, and you can select all or none, but I would really be interested to see the prevalence of these behaviors that you see on a daily or weekly or monthly or annual basis.
Oh, and it seems like we set the poll up to only allow one answer. Sorry about that. But if you want to chat with us, and you can say, I see them all, whatever you want to say to us in the chat box, you can add some more information there. Yeah, we're getting some I see them all.
Mm-hmm.
Yeah, all apply. Yes, seems like everybody sees all of this.
Well, that makes it very difficult to only select one. So, but it's promising, I guess, from my end to hopefully show you that maybe some of these issues that you see on a regular basis are coming from or stemming from early environment and early caregiving that these children may be experiencing. All right, so last but not least, and I want to sort of wrap up here in the next few minutes for you. Oh, wait, times for insight and elaboration.
Do we want to get to the end, Dr. Mason, and save this
Yes,
one?
let's just go ahead, give them the time.
Okay, great. So the very last domain that I'd like to talk about is mental health. So in particular, I'm sure you encountered variations in mental health among your students all the time. And today I'm just going to talk about two domains of mental health, particularly internalizing issues like anxiety and depression, as well as externalizing issues, which are more of this operational defiance and conduct problems over hostility and relational aggression. And I want to just separate those two from each other because we can see, you can probably see those are very different behavioral profiles that you might see in your classrooms. When we look at mental health and in previously institutionalized and currently institutionalized children, what we do see is that children are in institutional care or children who have experienced neglect are most likely to have more increased internalizing and ADHD diagnoses. We see fewer internalizing diagnoses, but I want to say that this data is from when children are 12. So it may be that some of these internalizing problems will develop a little bit later. It's a lot easier to see externalizing problems in younger children. But when we think about how we might want to reduce these mental health issues in children who participate in our foster care intervention, we really wanted to look to see whether or not children who stayed in the same home, the same foster care home, had better outcomes long term. And indeed, that is what we saw. So we found that children who had a foster care disruption, so kids who were pouncing from house to house or caregiving situation to caregiving situation, they were much less likely to have internalizing problems. They were also less likely to have externalizing problems. Although very interestingly, it did not decrease the prevalence of ADHD. That might point to the fact that ADHD has a different developmental course that can't be ameliorated by caregiving environment. So altogether, I think sort of everything I've shown you may be painting a really dreary picture for children who have experienced early institutional rearing or neglect. And I just want to sort of take a moment and pause and say that early neglect doesn't mean that a child is doomed. So it isn't a prescription. If a child has a neglectful home to begin with, they may be more likely to display some of these disruptive behaviors or mental health outcomes, but it isn't a one-to-one correspondence. We also have really interesting work that's sort of ongoing, and I've done quite a bit of this work myself, looking at how children may sort of have resilience to these early caregiving environments. So some of my work has found that children who prefer to look at happy faces or more positive faces, those children tend to fare better and have less mental health problems down the road. So thinking about how we might have a child think about the glass half full or concentrate on the positive as a possible intervention is something that we're really starting to think about for children who've experienced early neglect. Another thing that we've found is that executive functioning, children who are able to sort of go through a neglectful environment but still develop good executive functions, they're less likely to have mental health problems down the road. And that's true both behaviorally and in the brain. And so some of the ongoing work we're trying to do is really locate some of these early markers of resiliency. And if we see them, try to foster them. And if we don't see them, try to think about how we can introduce some of these protective factors down the road for children who are experiencing neglect in early life.
Okay, so again, looking at the time, I think what I want to point out is that Sonia has some other related work that I think some of you may be interested in. Not only has she studied resiliency, but also social anxiety. So could you speak for just a moment about social anxiety, and then we will make sure and give a link afterwards to perhaps some of your research in that area.
Yes, I'd be happy to. So yeah, while I'm really interested in thinking about how the brain and cognition may change how children's mental health progresses over the lifespan, one of the ways I've done that is looking at these populations I was just talking about where children have experienced neglect. But one other place that I'm really interested in this question is children who have different temperament styles. And particularly, I'm really interested in children who are temperamentally fearful. So these are your toddlers who don't like new things. They find new things really stressful. And we know those toddlers are at a 7 times increased risk of developing social anxiety later in life. And something that I'm really interested in is trying to see social anxiety symptoms really don't emerge until, late childhood, early adolescence in a really reliable pattern. So one of the things I'm really interested in is thinking, can we see differences in how children behave in the classroom or cognitively or in the brain that really can help us identify children who are at risk for later social anxiety? And so one of the things that I've put a lot of work into is looking at executive functions. And myself, as well as some of my colleagues, have really fostered this body of work showing that children who are really good at inhibitory control, so those kids who are really good at stopping a response, so they go to do something, they're able to stop themselves, you usually think of that as a really, really adaptive skill. Kids who are good inhibitors on average do thrive long term. However, those children who are really good inhibitors, who are also pretty fearful, are actually more likely to develop social anxiety long term, or at least that's what my research has been showing. So these kids are monitoring, they're on edge, they're always watching, and that makes them very, very good at inhibition, but it also makes it very, very difficult for them to sort of function in the broader world. And so I actually have just an even more hot off the presses paper showing that these kids who are really, at risk are really good at monitoring in the moment, But when they're monitoring in the moment, what they're giving up is this ability to plan ahead and use more planning for the future. And those kids who are really in the moment, just concentrating on performance, just concentrating on monitoring what they're doing, are sort of losing the bigger picture. And that is sort of leading to this style of anxious cognition. So the idea of your kids who may be a little bit fearful and high monitors trying to foster this idea of maybe letting go and planning ahead may be a really adaptive way to sort of steer them on a different trajectory that's less likely to lead to anxious cognition later in life.
So what I'm thinking with that is that we may have some youth for whom, if we arranged the classroom environment, so there's ways for children to feel comfortable with being spontaneous.
Yeah.
That might be helpful, because many times there's a right or wrong answer, for example, right? Or you're in a social situation in school and there's a right way to behave and a wrong way. If in fact we can allow for more flexibility and set up environments so that children won't be as fearful of not performing correctly, perhaps that would help ease some of this.
That's right. I think that that's a good way to think about it. And I also think, you know, for those children who really are, you probably almost think of them as some of the best kids in your class. They're a little bit anxious. They're less likely to act out. They're likely to be really concentrating on getting things right, doing it perfectly, and that's okay. That's really adaptive for some kids, but really concentrating on that so much, having that fear and trying to make everything perfect may be a really difficult combination. So trying to sort of disentangle, you know, you don't have to be perfect, close enough is good enough, allowing for some slop may actually help those kids sort of loosen up a little bit, and maybe also think about, you know, planning behaviors longer in advance versus focusing on what's happening in the moment may be able to help them abstract to sort of that monitoring behavior that may drive anxious cognition.
That's fascinating. So Dana, I think we've got a couple wrap-up slides. Is that right?
Yes, we do.
Other than that, I just wanted to say, you know, the relationship between early life stress and neglect and mental health isn't just in institutionalized samples, as I just covered. It's also very prevalent in the United States, and there's a large body of literature suggesting that children who experience early life stress in the United States are at a lifelong risk for mental health disorders, and really broadly across both internalizing and externalizing domains. And there's a really nice chapter on this that I would highly recommend, because it's really nice and accessible in this Oxford Handbook of Stress and Mental Health by Kate McLaughlin and her colleagues. And then just overall, I just had a few conclusions for some of the Bucharest data, but I hope I showed you today that children who were raised in institutions show impairment in cognitive and brain and mental health, but also I can tell you in a variety of other domains, physical development and social emotional development. But that our model of foster care, this really Cadillac version of foster care, where we really tried to, you know, limit the number of transitions and really provided high support to foster care parents, was pretty effective at ameliorating some of the negative consequences we see with institutionalization. So thinking, you know, for children that in your classrooms and schools that are experiencing neglect, putting them into a family-based environment that is much more fostering may be really, really important. And then finally, removing children from experiences of neglect, if we're going to do it, doing it earlier is better than later, because we do see evidence of these sort of sensitive periods where earlier removal really does mean better neurocognitive functioning down the line. And so with that, I just want to thank you again for having me.
And thank you so much. I think we've learned a lot, and it's, I think, really important to think particularly of early childhood for the young kids and what we can do in schools and in daycare settings. And it seems like there is a lot that could be done. So appreciate you being with us today and sharing with us. And Dana, I believe you may have a couple more comments.
Yes, I do. We just wanted to remind you that today's webinar funding comes from the Substance Abuse and Mental Health Services Administration, which requires us to evaluate our services. So attendees that provided their email address through the registration process will receive a survey within 24 hours after the close of today's event, along with today's slide presentation. That will include a link to request your CEU. And we really do appreciate your honest and anonymous feedback because it helps provide information that assists us in planning for future meetings and programs. We also hope that you can join us for some upcoming C-TLC events. We have another webinar in a few weeks about a district-wide approach to coordinating mindfulness with Jeff Donald from Montgomery County. We also have a couple of new book publications coming out on February 4th. Visioning Onward, a guide for all schools, will be released. And later in February, Mindful School Communities, a follow-up to our mindfulness practices book, is going to be released. That's about the 5 C's framework about nurturing heart-centered learning. And then in February, if you're in Atlanta or around Atlanta, Dr. Mason and myself will be presenting on our work in the C-TLC and our SCATE assessment tool at the Creating Trauma-Sensitive Schools Conference. Finally, we still have our CTL book study, which began in September 19th, and we have our last one coming up. And just thank you so much for attending, and please email info@edimprovement.org if you have any questions. And we really thank you for your participation. Fellows, please stay on the line, and we will have a brief meeting. Everyone else, thank you. And Dr. TROLLER-RENFREE, thank you so much.
Thank you so much.